The Wound Care Center at Shady Adventist Hospital is a multidisciplinary clinic that deals with complex wounds of the lower extremity, upper extremity, and basically what happens is patients are referred to us to deal with these complex wounds that are having difficulty healing. The Wound Care Center will deal with just about any type of wounds, albeit a burn to a complex diabetic wound to a sacral ulcer, as severe enough as a bone infection. We have vascular doctors, infectious disease doctors, internal medicine doctors, podiatrists, general surgeons, plastic surgeons, all working basically as a team to deal with these complex wounds. It benefits the patient because it's all inclusive. So basically, if all the information is available in one chart, nothing is lost in the basically in the interpretation. Not only that, these doctors work as a team, so I can contact these doctors at any time. It makes my life easier and makes the patient's life easier. Not only that, since it's in the hospital setting, if I need to admit you that day, I admit you that day to get all the testing done immediately, and it expedites care. If you delay on a bone infection 1 week, it could be the difference between an amputation and no amputation. A great example would be, let's say patient X comes into the clinic, and patient X comes in, she's had a wound for approximately 6 months, non-healing, and finally she's referred to the clinic. Well, our job is to identify the etiology or the cause behind why this wound isn't healing. Once we identify basically why the wound isn't healing, then we develop a protocol behind treating that. So let's say, for example, I identify the patient has an occlusion of an artery in her leg. Well, that's not my specialty, so I have the vascular doctor treat that occlusion to get more blood down to the foot. So now we've got 2 doctors on the team. Now let's say we also identify the fact that the patient's blood sugars aren't controlled properly. So now I have the endocrinologist also dealing with the patient. I have a team of nurses that are also involved. So I have 2 doctors and my nursing team. Now let's say I also identified, and I don't think I said this, bone infection. Now I have an infectious disease doctor on board. So 3 physicians and my nursing staff, including myself. So I apologize, 4 physicians. All specialists need to be able to do their specialty. And if you have the specialist dealing with their specialty, you're going to get a much better approach. And everything is included in one chart. And I think that's essential behind follow-up. Patients are happy when they come in, they enjoy the staff, and I think the quality of care rendered makes a much more comforting environment.